If your pet were suddenly sick or injured, you'd automatically take him to your local veterinarian or pet hospital. But veterinarians provide far more than just emergency care. Regularly scheduled, thorough medical examinations are key to maintaining the health and well-being of your pet, not to mention a great way to strengthen the wonderful bond that you will develop with your new friend, as well as solidify the bond between the two of you and your veterinarian. Hopefully, your new friend is healthy and doing well. But even healthy kittens and cats need regular veterinary checkups and a little home maintenance to keep them in tip-top shape. If you have a kitten, your veterinarian will examine him closely for existing health problems and will start him on a series of vaccinations to help build his immune system and protect him from some feline diseases as he grows and matures. Just like new babies, your kitten needs these immunizations to protect him from deadly diseases. The first injection is only the foundation for developing protection, and the subsequent injections are the ones needed to build up a sufficient level of antibodies. This series usually takes place from 7 up to 20 weeks of age, and it is extremely important to complete it to ensure a healthy immune system and protection. Many veterinarians, including me, also recommend having your cats, especially ones that go outside, implanted with a microchip as a means of permanent identification. A combination of the microchip and an external ID tag will provide the best form of identification. If your cat is ever lost or stolen, this combination may be your cat's only ticket home. Another very important subject to discuss with your veterinarian during these early visits is pet health insurance for your new friend as a great way to be able to continually provide the best health care. Veterinary diagnostic and treatment modalities have improved greatly over the years, and many hospitals are now equipped with blood analyzers, ultrasound machines, endoscopes, and even laser machines. These modern advances allow us to provide the best health care for your pets, but have increased the costs of the services that we can provide. Pet health insurance is a great way to offset the higher fees without sacrificing the best care possible. Many policies available even offer coverage for routine care, microchip identification, spay-neuter, and vaccinations, so make sure to speak with your veterinarian about pet insurance. Many kittens are born with parasites or worms which are passed on from their mothers. It is very important to bring a fresh stool sample with you so your veterinarian can check your cat for the presence of any intestinal parasites. Don't use any of the over-the-counter dewormers, as they may be ineffective or dangerous for your cat. Your veterinarian will prescribe an appropriate and safe medication based on the results of the stool analysis. There are a number of diseases which cats are routinely vaccinated against, but the vaccination and booster protocols vary depending on the disease prevalence in your area, your cat's lifestyle, and its own immune system. Many veterinarians are now giving boosters for certain diseases only once every 3 years, while others are evaluating blood titers to determine the need for any particular vaccine. Still, other vaccinations, such as rabies, may be required by local ordinance or state law. I highly recommend following your own veterinarian suggestions. In most parts of the country where mosquitoes are a problem, your veterinarian may also want to check your cat, especially an outdoor cat, with a blood test and begin preventative medication against heartworms. Heartworm disease is not just a dog problem. This is very important since a heartworm infection can be fatal if left undetected and untreated. Prevention is simple, usually requiring nothing more than a long-acting medication. There are a few areas of home maintenance that you want to get your cat used to nice and early. The first of which, believe it or not, is dental care. That's right, brushing your cat's teeth. About 80% of all cats over the age of 3 have some degree of dental or periodontal disease, so this is no laughing matter. Dental disease hurts. It can also shorten your cat's life by causing kidney, liver, and heart disease. There are several toothbrushes, finger pads, and gauze pads on the market, along with a variety of toothpastes specifically for cats and dogs to help make this home chore more enjoyable for the both of you. Remember, never use human toothpaste on your cat. If you get in the habit of brushing your cat's teeth before his meals or before a treat, he'll actually start looking forward to it. 2 to 3 times a week, a few minutes each time, that's all it takes to keep your cat's teeth and gums healthy and his breath nice and fresh. Bad breath is not natural. It may be a sign of dangerous periodontal disease, so make sure to have your cat's teeth and gums checked regularly. Although cats have a reputation for being very clean and always seem to be grooming themselves, that doesn't mean you're off the hook. Cats do need occasional baths, especially if they're suffering from a flea or skin problem. And especially the long and medium-haired cats need daily brushing or combing. As I mentioned earlier, this is your best defense against hairball problems. Certain products which help cut down on shedding and others which help condition the coat will also help. You'll find an awful lot of shampoos, coat conditioners, and flea and tick control products lining your supermarket shelves. I suggest you try to avoid these and instead have your veterinarian or qualified pet store representative recommend effective skin and coat care formulations for your cat. Be sure to ask your veterinarian about flea or tick control products for your cat, your home, and if your cat ventures outdoors, your yard. Cats are extremely sensitive to many flea products, and many of these products, which are safe for puppies and dogs, can be very toxic to kittens and cats. I recommend you stick to the products available from your veterinarian, as these are safe and effective. Many of these require only a single monthly application, and some even provide additional protection against other parasites. Avoid dips in any over-the-counter spot-on products, some of which can be deadly to your cat. If you have a lot of trouble bathing your new friend, don't feel badly, because you're not alone. Cats can be tough. You might consider having it done by a professional groomer. Another integral part of grooming, one which will help keep your skin, clothing, and furniture in good shape, is nail clipping. People tend to have a lot of trouble with this, but it's really quite simple. Firstly, you need a good toenail clipper like those you see here. You want to squeeze the toe on top and bottom, which will extend the nail. Then clip the sharp tip. Just avoid the pink part, which is called the quick, and you'll be in good shape. Don't forget those first digits on the front feet. Those are the ones that always seem to get you. You may have your veterinarian or groomer do it the first few times with you until you catch on. Cat's nails usually need to be trimmed about every 3 to 6 weeks. If you work with your veterinarian to practice preventive medicine, stopping problems before they can start, you greatly increase the odds of your cat leading a happy, healthy life. Younger cats should have routine physical exams at least once a year, and older cats should be seen 2 to 3 times a year. Simple tests like blood and urine screens, x-rays, and electrocardiograms are a great way to assess your pet's health and detect problems before they may become serious or life-threatening.